Patient Rounding in the Emergency Room by Jesse Koistra, RN. So patients coming into the emergency department face a lot of fear of the unknown and a lot of waiting while the results and tests come back. While call lights are in place to have the patient call the nurse or the assistant in the room, this can be a cause of great frustration to the nurse for the multiple calls in a short period of time. It's also a source of frustration when the patient that is using the call light multiple times is not getting his needs met or feels like he is a bother, consistently asking for items or has questions for the nurse. So in looking at survey responses from our department at Elkhart General Hospital, one of the paraphrased main themes that came out in the results were we do not see anybody for hours until after the initial meeting with the doctor. Our department implemented a 30-minute rounding system. While initially it seemed like an added stress to the nursing staff, I decided to dive deeper into our BXP scores, or our Beacon Experience Promise scores, and into the research to see if this implementation is even worth the trouble and the work. Leading to my PICO question, would rounding on a patient raise patient satisfaction scores, and does it decrease the workload of the nurses who need to consistently or constantly answer the call light? I used the good library from Goshen College's website, CINAHL, and the internet to locate my research sources. My search was also conducted by using the Journal of Emergency Nursing, and I was able to obtain our Beacon Experience Promise scores, or BXP scores, from Elkhart General Hospital ED from the time intentional 30-minute rounding was implemented in the department and at the time the study was completed. 4 references were found altogether. 2 were from CINAHL and 1 from the Journal of Emergency Nursing. The 4th one is from the EGH-ED BXP scores from December 2019 to March 2020. I found 3 articles that would fit my search criteria. These were all picked because they related to the PICO question, but also they related to the emergency nursing in general and showed obvious increases in patient satisfaction scores as well. 2 types of articles. One was a 2-were control study, one at Baltimore Washington Medical Center, and one was at a small rural hospital in Idaho. The 3rd was an evidence-based study report at Park West Medical Center out of Knoxville, Tennessee, discussing the hardwiring of hourly patient rounding in the department. So rounding is about engaging the patients, going in and finding out their needs and accomplishing the task, according to Ford in a report in 2010. Results were not yet available at the time of this publication, but they highlighted a brief case study of the study itself. There they implemented a specific set of topics for the rounder to use. The 4 Ps: pain, personal needs, positioning, and placement. They found that call light usage decreased by 52%. Nurses had more time to chart and complete tasks. Falls decreased because patients are less likely to get out of bed when personal needs are met. Ford, 2010. Not only did patient satisfaction scores increase, so did nursing satisfaction scores, and less stress on the nurses. So this brings up the question as well of could the strategy of rounding help keep our nurses at the bedside during shortages? So is this something that is feasible? So looking at the 2 articles right now, it was found that after 2 weeks of implementing rounding on a med-surg floor at the West Valley Medical Center in Idaho, that the need for more education on the process to ensure continuity. Though the call light usage was already decreasing, it was found that most of the nurses were already implementing the 4 Ps rounding process, but in the informal way. But the need was to provide a structured process to help with continuity. The study period in this research was done between October 3rd, 2008 to June 2009. HCAP scores steadily increased during this time, and the hospital moved to implement a hospital initiative to improve hospital-wide scores as well. In a research by Bakers in the Journal of Emergency Medication, their top tip to accelerate our results of rounding was leaders need to schedule hourly rounding on patients into their day to ensure it gets done. Consistent visibility to both patients and staff sends a clear message that addressing patients' top concerns are a priority. This also brought out that it's not just the clinical staff, but also the leadership as well needs to be doing rounding at some point throughout the day. This article also showed that a study done at Park West Medical Center in Knoxville, Tennessee had reduced the left without being seen by 23.4%, had decreased the AMA cases by 22.6%, reduced falls by 54.5%, and the call-out usage by 34.7%. And it had increased patient satisfaction scores by 5 to 20 mean points in all areas measured. So limitations in my research were article availability, staff compliance. Everybody had a different way of asking and rounding on patients, or it was something new, so there was a bit of pushback in our research, in the research articles with the staff as well. 2 of the studies were done on a med-surg floor instead of an ED, so that was a limitation. You had continuity implementation as well, making sure everybody said the exact same thing or scripted all the same way. Some of the studies were incomplete at the time of the publication of the article, so they were continually monitoring that. And then also another limitation that I took into account for patient satisfaction scores, especially with the Elkhart General's BXP scores, was our surgeon nurse appreciation in general due to our pandemic of COVID-19 during the time of implementation there. So in our implementation conclusion, I came to that patient rounding is effective and least stressful in caring for our patients. The first few weeks can be hard relearning how to think and rethink the process and implement the plan of rounding. But as with any new process, it becomes that new norm and you start seeing results. So first of all, why do we need to do it? Patient satisfaction scores were low in our department. We had 2 sentinel events that were preventable. And we had alarm fatigue throughout the staff. Alarms were going off and nobody was paying attention to those alarms as well. The what, when, where. So we round every half hour on each patient in the ED. We concentrate on the patient's needs when making a note, and then we make a note about that interaction in our patient's EMR. So who does this? So we have a dedicated rounding tech or an MA that was on the floor to be a rounding tech during their shift. Their job was to round on all patients every half hour and make a brief nursing note in the EMR about the patient condition and what they did for the patient. While this ensured that rounding also was completed, all clinical staff were informed and educated that they too can round on a patient if time permits as well. So how did we do this? So EGH ED implemented a call-out system that sets rounding timers in the room. And then we had a 30-minute dedicated rounding tech who asked about care and if they needed anything. The rounding tech then made nursing narrative on the patient's chart. We also implemented the AIDIT system, an acronym which stands for Acknowledge, Introduction, Duration, Explanation, and Thanks. Using this method of interaction with the patient, the staff member acknowledges the patient, then introduces themselves, explains the duration of when they will return or the duration of their tests, explains any process or task being done to them, and then thanks them for their time and asks them if they can do anything before they leave again. We also use our Versa badges on each of the staff members. This monitors who comes in and out of the room, so we can also shut off rounding lights, but we can also keep track of who's entering the room and who is or how many times people have been in the room with that patient. Patient rounding is an effective way to increase patient satisfaction if done correctly. Continuity and communication with the patient and care of the patient needs to be a priority in implementing this method of care. When educating appropriately, nursing staff will find it will also decrease stress due to being proactive in care instead of reactive in the care of the patient. So Elkhart General Hospital ER implemented half-hour rounding using a dedicated rounding tech in January 2020. Since that time, according to Shannon Black, ER director at Elkhart General Hospital, we have seen an increase in our scores from 3.96 in January 2020 to 4.46 to the first half of April 2020. The call-out usage had decreased and the alarm usage had decreased as well, decreasing these noise levels and stress levels of the nurses and the patients, helping out in getting our tasks done efficiently and being less stressful at the end of our shifts. These are my references for this research. Thank you for your time.